Did you know that even in 2025, a staggering number of Americans are still without health insurance? It's a reality that touches millions of lives, and the latest numbers from the CDC are raising some serious questions about where we stand. Before we continue, if you want to stay on top of everything happening in U.S. politics, hit that subscribe button right now and leave a like. It really helps this channel grow. Now let's get into it. The Centers for Disease Control and Prevention, or CDC, has released new estimates from their National Health Interview Survey, and the headline is that about 8% of the U.S. population was uninsured in 2025. Now, on the surface, that might sound like good news, especially when you consider the context. This percentage is reported as largely unchanged from the previous year, 2024. And critically, the CDC notes that the uninsured rate remains lower than it was back in 2019, before the pandemic really hit. So, by some metrics, we haven't gone backwards, and in some ways, we've made progress since pre-pandemic levels. But here's where the story gets more complex, and frankly, more concerning. While the percentage might be stable, the absolute number of uninsured Americans has actually grown. We're talking about an increase of about 800,000 people who now find themselves without health insurance coverage. That's nearly 1 million more individuals navigating the healthcare system without a safety net. And perhaps most heartbreakingly, this number includes an estimated 300,000 children. Think about that for a moment. 300,000 kids who might not have consistent access to doctors, who might face delayed diagnoses, or whose families are forced to make impossible choices between medical care and other essential needs. This is not just a statistic. It represents real families, real children, facing real challenges. So what's driving this? The CDC's numbers, as extensive as they are, don't always give us the full picture of the why behind these trends. However, we can infer some key areas of concern. For one, the stability in the percentage, coupled with the increase in raw numbers, suggests a growing population that is more vulnerable. This could be due to a variety of factors: people losing jobs and with them, employer-sponsored insurance, individuals who don't qualify for subsidies but still can't afford premiums, or perhaps a lack of awareness about available coverage options. The fact that the rate is still lower than 2019 is a testament to policies enacted in the years prior, particularly the Affordable Care Act. The ACA significantly expanded coverage, bringing millions of Americans into the insurance system. However, these new numbers suggest that those gains might be plateauing or even subtly eroding as economic shifts and policy changes take hold. We need to ask ourselves, are we doing enough to maintain and build upon the progress we've made? Who is most affected? Typically, uninsured populations are concentrated among lower-income individuals, racial and ethnic minorities, younger adults, and people living in states that have not expanded Medicaid. This latest report, by highlighting the increase in uninsured children, suggests that the burden is also falling heavily on families. When children are uninsured, it can have long-term consequences for their health and development, impacting their ability to learn in school and their overall well-being. It also places an immense strain on parents, who often bear the brunt of the financial and emotional stress of navigating a broken system. What are the possible outcomes? An increase in the uninsured population can lead to higher healthcare costs for everyone. When uninsured individuals do seek care, they often do so through emergency rooms, which are the most expensive way to deliver healthcare. These costs are then often absorbed by hospitals, which may pass them on to insured patients through higher premiums or seek government subsidies. Furthermore, a less healthy population means a less productive workforce and increased demand on social services. Politically, this issue is a minefield. It touches on core debates about the role of government, individual responsibility, and the fundamental right to healthcare. We can expect this to be a recurring theme in upcoming election cycles, with different parties proposing vastly different solutions, from expanding government programs to advocating for market-based reforms. This data is a call to action, a stark reminder that the fight for accessible and affordable healthcare in America is far from over. It underscores the need for robust policy discussions, innovative solutions, and a commitment to ensuring that every American has the peace of mind that comes with health insurance. So what do you think about this? Is the stability of the percentage masking a growing problem, or is the overall trend still positive? Drop your opinion in the comments below. I read every single one. We'll keep a close eye on these developments and bring you the latest analysis as it unfolds. Thanks for watching.